Hello guys, welcome back. Today we will discuss about history collection. History collection is one of the major part of psychiatric diagnostic procedure. When we do proper history collection, we can come to a conclusive or evidence-based diagnosis. So, a nurse or the healthcare professional who is collecting history from a psychiatric setup must be aware about how to collect the history. It is little bit different from the general history collection. So when you are trying to collect the history, or when you are collecting, or when you are assigned to collect the history of a patient, you must know some steps how to collect the history, from where you can collect the history, and what is the procedure and what is the method that you have to understand properly. And here we will discuss about how to collect the history and what are all the steps of collecting history. History collection playing a major role in the psychiatric diagnostic procedure, as I've told. So history collection with steps we will discuss here. First thing in history collection is demographic data collection. So what does demographic data means? The name of the person, age, sex, education, occupation, marital status, and along with that you have to write the case number and the ward. All these informations you have to add the first session of your history collection. So when you start writing, you have to write the first heading, that is demographic data. Under demographic data, you have to write name of the patient, then age, sex, education, occupation, ward, in which ward the patient, acute ward, low intensive ward, high intensive ward, and type of ward, forensic ward, which ward, that you have to write. Then case number. This is you will get from the case study and the patient's information and case sheets that you have to write. And another very important point is informant. Who is giving information about the patient? Sometimes you will not get all the information from the patient. You know that the patient is mentally unstable and mentally unsound or mentally handicapped. In that stage, the patient cannot give the proper information about the patient. So if you are not getting the proper information, definitely that will affect the final diagnosis and final planning, implementation, etc., etc. So informant, who is there to give information regarding the patient, you have to get the information from that particular patient. So while writing the history collection, informant, that word particularly you have to add, and you have to write specifically who is giving information about the patient. So that is the first section of your diagnostic procedure. Next thing is present complaints. So next point is present complaints. Here you have to write the present complaints of the patient, and this thing you can write in two ways, either in the patient own words or from the informant's point of view. So in the patient point of view you can write, or in the informant point of view you can write. For example, in the patient words, how we can write? The patient complains that I have tiredness and restlessness since 2 days, since these days. The patient complains that I have problem. So the patient complains that I have tiredness and restlessness from past 2 days. Otherwise you can write in informant words. Based on the informant observation, the patient is having lack of appetite and hallucination from past 3 days. One thing always you must keep it in your mind while writing this present complaint, that is you have to write the problem and for how many days or week the problem is persisting. So problem and for how many weeks, how many days, that you have to mention properly. So this is the second session of your history collection. So first thing is demographic data, second is present complaints. Present complaints you have to write the thing in patient's words or in informant's words, and you have to inform, or you have to specifically mention the date, onset, when it is started, for how many days it is prevailing in the patient, that you have to write. So that is the second heading. The next is present psychiatric history. That is the next heading, present psychiatric history. So what is present psychiatric history means? That the nurse should supposed to write. Nurse observation is writing in present psychiatric history. There you have to write the onset of the condition, either it is in an acute stage or in a chronic level or in a subacute level, whatever it is, that you have to write. Then duration, from which stage to which stage, which day to which day, intensity of the condition, any precipitating factors is there, or like other factors which is increasing, any triggering factors are there around the patient, in the surroundings of the patient. If it is there means you have to specifically mention that yes, or no means no. And the current episode and other disturbances associated with this present condition. So everything you have to write in a professional way. So present psychiatric history means the nurse need to write the actual situation of the patient based on the present complaint of the patient as well as the case notes. So present psychiatric history, that is the third heading you can see in a history collection. So first heading is demographic data, second is present chief complaints from the patient point of view or from the informant's point of view, then present psychiatric history, that is the nurse explanation. Next thing is past psychiatric history. In the past psychiatric history, you have to write the past history of the patient. The patient undergone any kind of psychiatric treatment before coming to the present hospital. There, you have to depend the case notes, and from the informant also you will get some information, but most probably the thing is case sheets or the notes or the official records about the patient will give more information about the past psychiatric history of the patient, because sometimes the patients cannot able to give the proper information because the patient is unstable. So always collect the past psychiatric history from the notes and reports. If there is no past psychiatric history, you can write no significant history of past psychiatric history. So if there is no history, you simply write no significant history of past psychiatric history. So that is the fourth heading. So first heading is demographic data, second is present chief complaints, third is present psychiatric complaints or psychiatric history, then next is past psychiatric history. Next heading is past medical history. Past medical history also very important, like the patient undergone any kind of medical treatment, admitted in the hospital for a long period of time, for fever and for minute things. If the patient is going to the hospital, no need that information. For this also you have to depend the case studies and the notes, and if there is no past medical history means you can write the same thing, that no significant history of past medical history. The next heading is past surgical history. The same format you have to follow. If there is any official information regarding any surgeries undergone for the patient undergone for any surgery or any surgeries information means that you have to specifically mention, and if there is no specific history means you can write no significant history of past surgical history. Next very important heading, that is family history. Family history is playing a major role in the diagnostic procedure of psychiatric conditions. So family history will helps to understand how the problem is arised in the patient, whether the family is related to this problem. If the problem is in the family means first you have to give treatment for that problem, then only you can come to the patient. So family history is playing a major role in the diagnosis of mental health problem. You must add at least 3 generations family history. If the patient is having problem means patient's fathers and father's father till grandfather you have to go and you have to get the informations. Like this informations you can collect from the informant, and you have to write the proper family tree with the specific informations, family tree and the specific informations. That is the another thing you have to add in the history collection. So again I'm repeating, first heading is demographic data, second heading is present complaints of the patient, third heading is present psychiatric complaints of the patient, fourth thing is present or past psychiatric history, then past medical history, past surgical history, next is family history. Family history is very, very important thing. So the next history is personal history. Collection of personal history is very, very important, because personal history will helps the person or helps you to understand how the person and how this person is reached in front of you as a patient. So the patient personal history include their childhood histories, natal histories, prenatal histories, school history, friendship, education history, occupation history, marital relationship or marriage history, sexual history, employment history, etc., etc., etc. All the personal informations related to the patients need to include in the personal history. And while coming to the heading, First heading, you have to write childhood history. In the childhood history, you have to mention the behavior of that particular child during their childhood. Then any kind of illness they have affected during their childhood, and the malnutrition means health status of the patient. Whether the child undergone, I mean the particular patient undergone any kind of nutritional problem, vitamin deficiency problem, etc., etc. All these informations you can collect from the informant. Next thing is school history. So the next heading is school history. In the school histories, you have to specifically mention age of joining school, behavior in the school, relationship of that particular child with friends and teachers, performance in the schools, and learning disability or any special education needs we're using for that child. All the things you have to include in the schooling history, because all these informations will really help you to come to a conclusive diagnosis. So next thing is occupational history. In the occupational history, you have to write about the occupation of the patient. If the patient is a child, means no need of writing this section. Otherwise, you have to add this section. In this section, you have to write what is the type of job they are doing, what is the age and in which age they have joined the job, performance in the job, and what is their relationship in the job place, and what kind of attitude they are maintaining towards the job, and whether they have changed the job, and if they have changed the job, specifically you have to write the reasons for changing the job. These are all the things you have to include in the occupational history. Then while coming to the sexual history, you have to ask the specific questions like age of attaining puberty, knowledge about puberty, menstrual cycle information in the case of female, marriage and relationship informations, and type of marriage and related things. All these informations you have to ask properly, because all this personal information will definitely help the psychiatric professional or the nurse to come to a proper diagnosis. So the next thing is premorbid personality. So that is another heading and very important heading that you have to mention in the history collection. In the premorbid personality session, what we are doing means this section will help to understand the personality of a person before affected with this condition. And if you get an idea about the actual personality of the person, that will really help us to come to an effective conclusion. And normally this personality information regarding the patient can collect from the informant. You need to ask the person who is taking care of the particular patient, and in that you can add the informations like attitude of the person towards the family, towards the caregiver, towards the society, then attitude of the particular patient towards self, and how they are maintaining the relationship, whether the person can trust others, and what is their ability to trust others, etc. Then apart from that, what is their moral belief, what is their religious belief, and how was the mood of the person during the normal time while talking to others. Then any mood swings or irritability, whether you have observed, and what is the habit of the person, and what activities they used to do during the leisure time or their free time. Then attitude of the person towards the reality and fantasy. Everyone has some reality thoughts and fantasy thought, and what is the present attitude of the person, and what is the previous attitude of the person towards reality and fantasy, and what is the character of the person, fun loving or serious. All this information you need to add under premorbid personality. So these are all the headings you have to add while collecting the history or while writing the history collection format. First thing is history collection, that means demographic data. In demographic data, you have to add age, sex relation, or occupation, name, ward, and case, and all these informations you have to write. Then next thing is next thing is present complaint of the patient. Present complaint of the patient, that means what are all the chief complaints of the patient, either in patient's point of view or in informant's point of view. If it is in the patient point of view, you can write according to patient I have, or the patient says that I have this problem, then you have to specifically mention from which day to which day or for how many days the problem. Then otherwise you can write as per the informant information. The next thing is present psychiatric complaint, present psychiatric history, that you have to mention in your own words. This must be based on the information as well as from the information from the case notes. You have to write the acute condition, or it is subacute, or it is chronic, or onset, intensity, precipitating factors, associated disturbances, everything you have to write. Next heading is present medical history, present surgical history, past medical history, past surgical history, all this information. Then personal history. In the personal history, all the information related to their childhood, schooling, then their education history, occupation history, then social history, then marital history. Then you can come to the premorbid personality session. There you have to write more about the personality of the person. So this is about the history collection, and these are all headings definitely you have to add in the history collection. Hope you understand, guys. Thank you.